GetCheckedOnline is an internet-based testing program for sexually transmitted and blood-borne infections that was launched and expanded in the Canadian province of British Columbia. It was designed to reduce barriers experienced by sexual and gender minority men when accessing clinic-based testing services, such as long wait times and stigma from healthcare providers. In this study, we used a local sample of gender and sexual minority men to answer 2 questions. First, we wanted to know who is and who isn't using GetCheckedOnline to identify potential inequities in service use. We found the participants who identified as Indigenous or another racialized minority, as well as those living with HIV, were less likely to use the service. In contrast, those who usually tested at a walk-in clinic compared to a sexual health clinic were more likely to use the service. For our second question, we also wanted to know what were the most common reasons why sexual and gender minority men used or didn't use GetCheckedOnline. On the one hand, we found that participants mostly used the service because it was convenient and it saved time. And on the other hand, they didn't use the service, mostly because they were checking it out just to see how it worked, or because they just preferred to test at their usual location. As a whole, the results from this study suggest that even though GetCheckedOnline has had a wide reach among sexual and gender minority men in British Columbia, there are still persistent inequities in service use. And we hope that the results of this study will help create ways to make internet-based testing programs more culturally appropriate and more accessible to those groups that still are underserved.